So, so basically, this summarizes my background. I was educated in Hong Kong all along, and my background is a little bit a mixture or hybrid of medical and basic sciences. And like other medical doctors, I completed my med school and internship, and that was like 6 years. And after that, like all other medical doctors, I went through some specialty training. And my specialty is pathology, which is, I'm not sure if you've heard about it, is studying some tissues under the microscope. And I'm a histopathologist specializing in liver diseases. And that specialty training was taking like 6 years, another 6 years before I got qualified to become a pathologist in the field. And then I went through some overseas training to further my experience in liver pathology in Mount Sinai in New York, and that was like altogether like another 6 years. After that, then majority of my peers would become a specialist and working in public and private hospitals and become consultants, etc. But what I did was a little bit different from many others, that I started my academic career at the Hong Kong U, and when during my training. And you can see there are some arrows here, which basically highlights the examinations that I went through, like being qualified as a medical doctor and then qualified as a pathologist. And then during my academic career, I also went through some specialty training in medical research, and that I obtained my higher degree, research degree. And it was pretty different, because you can see that during this period, I was doing a mixture of both medical training in pathology and also some basic science training. And so my life as an academic, clinical academic, is a mix of research, clinical service, and teaching. So what I do is I spend like half of my time doing what a medical doctor do. As a pathologist, we read tissues under the microscope and we sign out reports to give the diagnosis and give molecular information on tissues to help the diagnosis and management of patients. And then we also spend some time on teaching, which is including medical students and also some other programs under the faculty, like biomedical sciences, Chinese medicine, etc. And I also spend majority of the time in research, which is quite aligned with my interest in clinical diagnosis. I specialize in liver pathology. So my major research interest is in liver, and with a special interest in the molecular pathogenesis of liver diseases and liver cancer. And so, so this is pretty much my background and my life. And this is some pictures showing the base on the right lower corner is some liver specimens and liver histologies that we read day in and day out. And we also have some meetings to discuss the findings. And what I do is two streams of very different things. Like in my in the medical side, we read slides under the microscope, but then in the research field, we might be doing a little bit more molecular, wet lab based. So they are not really kind of well blended. So sometimes I do have to kind of try to find something in common. And so challenges, definitely there are some challenges, like as mentioned, how to bridge the gap between my daily work as a doctor and as a researcher. Yes, because like if you are a surgeon or if you are a physician, what you do, the type of research you're doing is mostly like a clinical study or clinical trials. So that would be more or less similar to what you're doing day in and day out in a clinical practice. But a pathologist is somewhat different. In a clinical setting, we are reading slides and doing tissue diagnosis, but then in the research side, we are doing something quite different. And in the very beginning, I would have to spend a lot of time dedicating myself to pick up something very new, and down to how to do some basic molecular techniques like PCR, Western blotting, which I had never got any experience in during my med school. And so the knowledge gap is quite big, and I have to read a very different set of journals to acquire the new knowledge. And time is definitely a concern, because if you can see, these years are actually some of the busiest and worst years in my life, because I have to do both things at one time. And I have to kind of like make myself competent enough to pass the examination, and also I have to pick new things as academic. And then some other thing is there might be that some challenges might also be like temptations, in a sense that I might be comparing myself with my peers who are mostly medical doctors, and they might be enjoying their life as a senior, or they may be making quite a good fortune in the private practice. But then I am always like the first few years in my career that I have to keep working and working. And it is also some sort of lonely feeling, because not many people actually go into this stream. And so and how I overcome that is like, for the knowledge gap, I was actually fortunate that when I joined the university, I was in my late 20s. So basically, I could still try to mix myself into the group, into a group of basic scientists, like in their 20s as well. So the thing is, I have to remind myself that I don't emphasize that I'm a medical doctor that might be different from the rest of the group. So I have to mix into the group and then learn together and pick things up together. So what we did is bench work, like what the other scientists or MPhil students or PhD students at the very beginning. And for time, there's no solution to that, because everyone got 24 hours a day. But I suppose we have to prioritize everything and know what is most important to you, and what is your interest. Like if you find your interest, then you will be able to focus on that part, and you'll be more ready to dedicate your time and effort in that area. And fortunately, we still have other peers in the faculty. So basically, as time goes by, I'm able to find like clinical academic of similar situation or similar age, that we can share the experience and also some feelings, so that we try to encourage each other and one another. So basically, this is my background and a little bit of sharing, and I hope to answer your questions in the Q&A session. Thank you very much.